Kelly. Good afternoon.
Good afternoon, and thank you, Madam President. I also rise in support of this bill. A little bit different tack than the good senator in that I'm not going to let the perfect be the enemy of the good here. This is a very good bill because it does move health care forward, and it's an issue that, as Senator Lesser indicated before the Insurance Committee, we heard very riveting and heart-wrenching comments and testimony from individuals who can't afford insulin, and that impacts the quality of their life on a daily basis. Just imagine what it's like for a moment to have to be dependent on a pharmaceutical and not being able to afford that. You know it's life-saving, you know you have to have it, but if your means don't allow it, what usually happens is people either ration their prescription, or if they're lucky, they get a referral to something like the Federal Qualified Health Center and can get access to affordable, low-cost, quality insulin. But for those individuals who begin to ration, that becomes a bigger problem, and not only has a situation where diabetes go out of control, but it has ancillary health problems and health care costs that then ripple through the entire health care system. This bill, getting insulin to people in a timely manner, will actually not only improve their health outcome, but I believe it will also help improve the entire healthcare system. That is why I think this is great, that we're going to make insulin more affordable to more people. While a cap on a copay or a deductible will achieve that in the short run, one of my concerns is that we're not doing anything for the long run. And while this caps the initial copay or deductible, it doesn't cap the cost of what it means on the system or to the carriers. The bills we're going to talk about today, the other three, the absentee ballots, the telehealth, and police accountability, all relate back to either COVID or current events, and I see the necessity to bring all these up. And don't let me diminish that the value of insulin is critical. It's very important. But I also believe that when we start looking at health care, we have a missed opportunity here, in that we're not also looking at trying to control the overall cost. If we're going to look at insulin, we should also look at what else is out there. How can we get our arms around the overall cost of health care so that we can not only bring the price down for somebody who needs insulin, but for every single family in the state of Connecticut that is paying exorbitant costs for their health care premiums? And we're not picking that issue up now. That is just as important as this one. We're also not looking at another part of this. It was touched on by Senator Lesser, but we're not looking at the inequity of health care outcomes based on race. We proposed the bill during session to look at that, to study that, to get an answer to that, because even before current events, the numbers were that striking that something needed to be done. We're not picking that up now. But that's an issue that needs to be looked at. And we need to be prepared to deal with that issue and to move that issue forward also. With regards to the inclusion in this bill of the Federal Qualified Health Centers and the 340B, Senator Lesser was a huge advocate of this, and I was very pleased to see that included. And I was also pleased to see that the President also sees the value of the 340B program and making sure that low-cost insulin is available to low-income Americans. We heard testimony, and you heard from Senator Lesser, that a monthly cost anywhere from $274 to $446 a month, $2,900 a year at the low end, $57 at the high end. We also heard testimony that people can get insulin through the FQHC at $14 a month. That's $168 a year. What a difference in the family budget if you're able to get your insulin at that low cost. What a difference that makes in that family and that individual's life and the health outcome that that's going to be achieved. What we do in this bill is we're going to ask, I guess, DSS to put together a work group to start to look at this issue so that we can start to refer individuals to the 340B program to make this more available, accessible, to improve not only individuals' life and health outcomes, but also bring about lower costs throughout the system. For these reasons, Madam President, I stand in support of this bill. I think it does a lot of great things right now, and it's why we have to do it now. We need to do this sooner rather than later. I think there were areas, one area is with the emergency 7-day insulin that was originally in Senate Bill 1, that provided that access to no-cost insulin for 7 days. It was in the bill, now it's not. I know that we've expanded that from 7 to 30. However, I think 7 at no cost is better than 30 at a cost. For those reasons, Madam President, I would urge my colleagues to support this bill. Thank you.
Thank you so much, Senator Kelly.